LPG gas. Remember, it has been a long-held desire by the government to widen the usage of LPG gas. Number one, in a bid to reduce what we call the use of biogas in the country, and also to reduce pollution levels, and as well as preserve our forests. But that has not happened to the scale that will be desired. So they will be appearing before the Senate Committee on Energy to respond to these questions. And also they will also be looking at the cost of fuel in this country with a question, how comes we haven't seen a significant drop in the cost of gas at the pump station? They will also be seeking answers from the ministry as to what Kenya is doing in terms of exploration of oil and the export of the same. Remember last year, Kenya shipped out its first consignment of oil. The response was absolutely good, but that was then. The markets have almost collapsed. And the question is this still a viable time for Kenya to start engaging, with this industry? Those are the issues that we shall be looking at later on the show. But for now, let's dive in onto the deep end and get into the issues at hand. ICT, the role of ICT in fighting coronavirus. I want to start with you, Delano. You represent an association of people who are in the security sector, where technology is key. Help us, first of all, understand, in the deployment of ICT in the security sector, are there lessons that can be learned when it comes to deploying the same in fighting coronavirus?
Yes, certainly, O'Brien. And I would say the studio is warm. However, we want to avoid any temperatures that go above 37.5 degrees.
So the beauty is that, your temperature levels, were taken when you are coming here. So you are good.
Thank you very much, O'Brien. In the security sector, I represent an organization known as the Protective and Safety Association of Kenya. This is Kenya's really first society that allows for individual membership of members who are from the disciplined forces as well as from the private sector, both serving and retired. It's a huge conglomerate, and we have a budding standard of excellence that we are growing within the country for this. When we talk about specifically ICT in security, predominantly we see the world is now changing and traversing its scope in the extent of the use of ICT to help in the role of security in this country. I think we're not unfamiliar with this. We see it almost every single day, O'Brien. When we drive down the streets, Uhuru Highway, there's cameras that are flashing at night, and there are cameras that are picking your license plate and facial recognition cameras that are spread across this country in very many different spheres, both public and private. So ICT is not a new thing in terms of security. It's something that has gradually been growing and spreading its wings within this country. And it's something that for us as a country, we need to embrace. Now, in the role of ICT and security, as far as COVID is concerned, we really can't sit on our laurels. The world, as we speak, is facing a global pandemic. Mm-hmm. In fact, the minute WHO said, O'Brien, that there is a pandemic, at that particular point, it was essentially from the United Nations organization called WHO, it was a declaration of global war against this pandemic. It meant we cannot fix this problem, and it's not going to be solved in any small way. So each country is now responsible to pull out its war resources, to pull out its strategic reserves, to pull out its innovation, to pull out its skills, its wisdom, its brilliance, to be able to fight the spread of this particular disease. Mm-hmm. I'll give you an example. For example, you've just mentioned that we are now over 5 million confirmed cases of the coronavirus around the world. And many countries are really suffering and very, very unstable. There is no immunity to this disease. There's actually no solution or vaccine. And anybody who comes and tells you, I have a vaccine that is going to solve the coronavirus COVID problem is not speaking the entire truth. The reason is we had in 1981 the emergence of the HIV virus that caused AIDS. And at that time, most scientists were very, very bullish and saying that we'll have this sorted in a couple of years. Now, almost 40 years later, we still don't have a cure. And even if you hear people saying, no, it's just a flu, we can get a vaccine for this. Remember, even your flu shot, you go for every other year, you still have to go for a new flu shot. Why? No. Because it's replicating. So the only way we can address is through technology.
And actually, if I can step on your shoes, if I'm allowed to, before I allow you to continue. I mean, the World Health Organization last week, they said, look here, this is going to be the new normal. We are going, coronavirus is here to stay. So it is up to us to find solutions and to find ways of living with this disease. So just continue. That's what I wanted just to say.
Exactly, O'Brien. I mean, we have to find ways. How are we going to live with this? Because it's a challenge. It's been something that nobody expected. Everybody expected 2020 to be a wonderful year. People had great plans. Everybody, you know, even if you look at our Kenyan situation and environment, where yesterday the civil registry said no more weddings. It's a big impact. What's going to happen to all the single people? What's going to happen? You see? So learning to live with this is going to be the new norm. We cannot say that in a year or 2 years or 3 years we will have a solution. That means we have to put in mitigating factors. And some of those are just technology.
Let's bring Gary on board. I mean, you know, Delano has just gone an extra length, you know, to expound some of the measures that has been used in the past, you know, in the security sector, you know, from the deployment of cameras, and we know the impact of this. When you talk to Kenya Police Service, they'll tell you that because of the CCTV cameras that was put in use in the year 2014, 2015, they saw a significant drop in crime. Actually, if I can be abstract with the figures, they would tell you that they saw a decline of about 46% in terms of crime in Nairobi and Mombasa. Peter and Gary, because you're in the industry whereby CCTV is your bread and butter, tell us this. Where do you see CCTV cameras, you know, coming to play to stop and help in the fight against coronavirus?
Thank you so much, Mr. O'Brien. I'm so grateful to be here. As you have heard, my name is Peter, Technical Director, Secure Digital. Thank you, as Mr. Dirano has said, in regard to the issue of corona and the issue of embracing technology through ICT. It's a very vital issue here, and because coronavirus is here to stay, and other necessities of issue of temperature that brings abnormal fever that cause other diseases, we need to embrace this technology. And the technology, it is not only for one brand in terms of CCTV. We have other products which relate to the issue of technology behind the issue of abnormal fever. And as you have said, when the government embraced the issue of technology to put CCTV all over Kenya, all over the counties, we saw a drastic drop in the issue of crime. And because we have coronavirus as an epidemic to stay with us, we need ourselves to, number one, to check which product do we need to embrace in the essence of giving us the result that we require. So as we live with this coronavirus, we're able to get a product that is able to give us the result so as we may be able to prevent the spread of this epidemic that is coronavirus. Number two is the essence of knowing that this product is able to be manufactured within our country. So as because sometimes when products are outside sourced and there's so much replica, there's so much counterfeit, we need also to take care of all those things. So as we may be able to have the product well efficient, and also to get revenue for our own country. And if these products will be able to be shipped, we'll be able to ship them from brands that we can relate with, and brands that we can work with, and brands that can give you good results. And then we have set up mitigations in ways that we can be able to control that we don't get counterfeit products that eventually will bring more danger than we have right now. Yes.
Delano, you know, I mean, he's just touching on the issue of counterfeits in this fight. And Delano, tell me this, how now do we bridge the gap between the availability of genuine products in the Kenyan market in the fight against coronavirus and the genuine products in the fight against the pandemic?
I'm very proud to announce to you, O'Brien, that Kenya is one of the countries that is at the forefront of fighting against illicit and counterfeit products. And we are very well led in terms of the government structure. A number of our members are actually driving this particular agenda. And our key concern, of course, at the onset of this particular threat and pandemic in Kenya was the fact that there would be quite a number of copycat products or counterfeit products that would be emerging into the mainstream and actually risking the lives of Kenyans. Our role really is to protect the lives and safety of Kenyans from all walks of life. So in Kenya's terminology, you know, everybody wants to be compliant, let's put it that way. So for example, let me use the example of the face mask. When it was made mandatory by the government of Kenya that everybody must wear a face mask, then we began to see the emergence of quite a number of what you'd call replica or copycat face masks. Not the ones, there are genuine ones that are being manufactured in factories all around the country, and very wonderful examples of masks that are being designed to extremely high caliber, for example, in Kitui, and you see others in the EPZs, etc. But there was also the emergence of some that were of substandard material. And especially when there's such a large deployment, it becomes quite difficult to track down and find out and verify. So we have the necessary government agencies such as KEBS, and they have a huge task ahead of them in order to be able to identify which masks are actually certified against this microbe. Because it's not enough, O'Brien, just to wear a mask. You know, you could be wearing a mask and this thing is just going through, in and out.
There's also the question of wearing the right mask.
Exactly. So for us, we do encourage very much local manufacture of all the calibers of masks because Kenya has the capacity. It always has had that capacity. And in fact, you'll actually find that at the beginning in January and February, quite a number of masks left this country going to other countries which were already being affected by the coronavirus. So standards becomes a key criteria. We have to observe best practice. We have to observe standards. We understand that the market is going to come into play, so demand and supply, and we've seen that happening already. We've seen that there's been initially a very massive demand, and the price soared of masks. But now there's a huge supply of masks in Kenya, and the price has dropped dramatically. So what we're saying now is, now that we've gone through that bump and that curve, why don't we now begin to also look at the standard? Do we have masks, for example, O'Brien, for little children? Those are the questions that we need to ask, because a large mask will not fit on a little child. And if we do have masks for little children, are they able to breathe through those masks? Because the breathing rate of a little child is very different from an adult. So we now need to start modifying how we work with masks. And I think this is going to be quite a number of years of innovation and excellence, and technology will come to the assistance of this.
I mean, it's very interesting that you are bringing out, you know, the issue of masks for toddlers or for babies. And nobody has actually thought about that, and this is something that I have always struggled. If myself, you know, I struggle to breathe when I'm putting on the mask, what about the young ones? I mean, are we coming back to you so that we can try to understand how we can go about this? But I want to come back to Peter. Peter, I mean, in February, when China, you know, was on the receiving end of coronavirus, we saw a significant deployment of robots to do delivery of goods and sometimes to offer prescription to patients. We also saw China, upscaling its use of cameras. I mean, cameras is a normal way of life in China, whereby they have cameras, tracking your movement all over the place, anywhere. But we saw this being upscaled, to identify people who are having COVID symptoms like, elevated temperatures and coughing and so much. From where you stand or from where you are sitting, do you believe that the same can be used here? And if yes, do we have the capacity?
Thank you so much, O'Brien. As I had said earlier, it's good we embrace technology. Number one, China and other countries, they have embraced technology. And they are able to use those equipments and those various products to be able to mitigate the essence of this pandemic. And for us as Kenyans, it's good and high time. We'll be able to look on ways we can be able to embrace technology and use it in the right way and be able to see what is we can do to make sure that these products are available and also they are affordable. Because number one key aspect is affordability. And if we can balance the two aspects, the two issues, we're able to have results that we can work with. ICT in terms of technology is very important in the essence of embracing a certain product. So we're able to look at it in a very deep and thoroughly done way. So as we may see that this product is able to help us and be able to give the results. I want to give one example of the products that we are using right now. We have an IP bullet camera or IP dome network camera, which is able to be installed in a way that is able to give you the temperature by capturing the facial appearance of a person and gives you the result of the temperature if it's abnormal or it's normal. You're able to adjust the temperature. If you set it at 37.5, if it reaches beyond 37.5, it gives you the warning and you can program the way you want. Do you want it to send an email? Do you want to send to receive an alert? Do you want to record? Do you want to, all those things can be able to be done. Also we have other devices which are like for access control, which have facial capture. Instead of touching and the other person comes and touch, you can be able to capture the face and gives you the temperature. Before the door opens, you're able to capture the face of the person, gives you the temperature of the person, and then the door opens. If it reaches a certain temperature that you have set, the door doesn't open. We also have like walk-through metal detectors. Walk-through metal detectors, when you pass through, they give you the readings of the temperature. They capture the face. They have been installed with the camera itself. So as you pass through, as it scans you, you're able to get the temperature of the person. And if there's beyond the set temperature, that is beyond maybe 37.5 or above, you're able to, the person who is there is able to stop you and be able to give you a more thorough checkup. So these are some of the devices which China and other countries have manufactured and have embraced, and they have able to control and they have able to give good results and good numbers in terms of their control as per technology is concerned.
And I mean, with this kind of knowledge, and I want to believe that the authorities in Kenya, they definitely are aware of this kind of existing technology. Why haven't we seen the same, being deployed in areas with high population or high traffic, like let's say, the port of Mombasa, the ferry, City Street, and so much, even bus terminals? How comes we haven't seen this? Is it that we are not aware that there is this kind of technology, or the price is beyond, our ability?
What I can say is we can't say that this technology have not been embraced.
I mean, here in Kenya?
Yeah. Most of the companies and most of the people and the government institution have started embracing this technology. Because number one, the product itself needs to be thoroughly checked and its performance. So we can say that this product and this solution is getting embraced, because even the product itself having the thermal aspect. It was there before, at the 2 decades ago, but it didn't have that concept of facial appearance that is able to give you the results at the top of the image. So that calibration, that adjustment of the product has been able to come because of the issue of this pandemic. So as we continue as the products ship in, you know very well that we have been having the essence of shipment in terms of the product. And because it takes longer and the availability of the products to reach here, so we are saying the slow of implementation, the slow of embracing the product has been slow, but it has been
Gary, do we have any public institution or public space where we have seen the deployment of thermal cameras, for example?
I can say for sure we have products which are existing and they have been embraced by the government institution right now. I can say they have, and they have been installed, and they are in use as we speak. Yes.
Delano, because I want you to also to step in and also help us in this discussion in regard to the deployment of this technology. I mean, how comes, bearing in mind this, that the corona pandemic, is a serious issue. It has the capacity, to debilitate our economy and our social life as well. How comes we haven't seen authorities, moving pretty fast by deploying this kind of technology in the fight against this pandemic?
I think, O'Brien, we may be missing the point here. The authorities are. The government is taking this very seriously. In fact, the other day, CS Joe Mushero appointed an ICT committee on COVID.
But Delano, just a minute. Sorry, I just want you to hold your point at that point, because we want to take you to the water provider services, whereby they are now discussing the issue of water scarcity in the country and the quality of water, and they have a point or two they would want to make during this pandemic, and then we'll continue. Let's first of all listen through.
Of 20 liters each. So the monthly family demand for 30 days is 6,000 liters. So it is suffice to say this is 300 jerrycans of 20 liters each. Now this is an informal settlement, and in the informal settlement we have very special gazetted tariffs that take care of the people in the informal settlement. So most of our companies, you will find that the price of water per 20-liter jerrycan is between 2 to 5 shillings on the higher side. So if I pick 5 shillings for the 300-liter jerrycans of 20 liters, that will cost 1,500. But if this was to be provided by water vendors at an approximate average price of 20, at times is 30, then Mama Silas will spend 6,000. So you can see 1,500 and 6,000. So it is true to say that if Mama Silas is able to get water from the kiosk, she will pay 1,500 per month, which is equivalent to 10% of household income. And if she was getting water from the private vendors, those are people who at times get water from our kiosks and other sources that we cannot control, then it will be 6,000, that is 40% on the higher side. So you are seeing that here, substantial amount of household income is going now towards water. Now, I've brought Gerald from Kilimani Court, middle income. He lives in a 2-bedroom house with a household income of 100,000 per month. A family of 2. So the daily demand, we have conventionally put it at 100 liters per person per day, because this is where you have flush toilets, and a flush will consume between single flush 5 to 20 liters, so you expect the water consumption to be high. So it is true to say that the family demand of Gerald is 200 liters, which is an equivalent of 10 jerry cans of 20 liters each. So family monthly demand, 6,000 liters. So I wanted to see the same amount of consumption and the price that is paid. So the same amount if Gerald was getting piped water, and our piped water, I want to say, remains the cheapest available source of safe and clean water. And this one is enunciated in Article 43 of the Constitution 2010, which is 2 shillings. That is on the higher side. But a jerry can, if our tariff is between 0 and 200 shillings, will cost 67 cents per 20-liter jerry can. So that is suffice to say that Gerald will pay 600 shillings per month. Now you can start seeing the disparities. So if you bring it and put it on the higher side, let him be paying 5 shillings, it will be 1,500. You'll realize 1,500 out of 100,000 household income. The proportion of income that goes to water for Gerald is 1.5%. So what I wanted to say is that water forms a very insignificant proportion of the household income. Yet in this country, this is the center of hydropolitics. So where should we focus? Is it in the informal settlements, or is it in places where we have middle income? Incidentally, these income middle areas is where we have people connected to water. So when you are saying you want people to get free water, you are not advocating for the common mwananchi. You are advocating for the middle income whose proportion of income is very insignificant. So I just wanted to paint that picture. And for the water vendors, it's not that we are at war with them. We recognize and appreciate the fundamental role they play in water service provision, especially in places where we don't have water connectivity. But what is important, and we can see the regulator extending his tentacles, is that now we need also that area to be regulated. Because 2 shillings and 30 shillings, the margin is wide. The way the price of bread is regulated, also we think the regulator should move and control the price of water, even for the private water vendors. Now, that one was just to demystify and deconstruct. As a nation, we are categorized as a water scarce country. Our water per capita is at 452 meter cubed against the United Nations threshold of 1,000 meter cubed per capita. So the water coverage is 57%, and the sanitation coverage is not very attractive, is at 25%. As water service providers, we have been specifically dealing with the seaward sanitation component, which stands at 16%. But now we are venturing into non-seaward sanitation. The other challenge is we have threatened pollution and degradation of catchment areas. And this one also impinges negatively in terms of scarcity of water. So some facts about water service provision in the country. We have 88 regulated water utilities, and the chairman has mentioned a number of utilities that are here. So we serve in a population service area comprising 22.8 million Kenyans. As you are aware, the population is at 47.6 million. So within the service area, we are servicing a population of 13 million with a total connectivity of 2 million. So you can see this is a big challenge. You look at electricity, the connectivity is at 7 million. So as the water sector, we are still lagging behind. The turnover of the sector is around 20 billion per year. The staff in the sector are 11,000. Now, why we are here today, we want just to share with the public, the nation at large, our role in terms of fighting the pandemic. We are aware on the global scale that COVID-19 has reached in excess of 5 million. We have more than 300,000 deaths, but we also have 2 million recoveries. So in Kenya, as you are aware, the first case was declared by the government on 13th March. So we are currently at 1,029 infection cases and 366 recovery. Unfortunately, we have 50 deaths, and I think we pass our condolences to the families that are involved. So actively, we are at 613 cases. So the government has issued, because of this pandemic, directives and protocols, which as water companies, we have been on the forefront to ensure that we execute them to the latter. And this is to ensure that there is containment of COVID-19. Where we have had high cases, the government has gone ahead and put the country under curfew, and more specifically, 4 counties are under lockdown, including Nairobi, Mombasa, Kilifi, and Kwale. So what has had a bearing?
That is Water Services Providers Association of Kenya, discussing the prevailing situation in regard to water. Remember, Kenya has been experiencing an above average rainfall in the last 2 or so months. But the most unfortunate thing is that most taps in the country are dry, well, because of various reasons. And they are saying that this could not have come at a worse time than during the coronavirus. And they are urging water service providers to actually upscale water supply, and more so in urban areas and informal settlements where the risk of mass spread of coronavirus is very, very high. And they're also raising a very interesting question here. I mean, during this area, you're supposed to keep on washing your hands at least after 15 minutes. How then do you wash your hands if the taps are dry? This is a question we hope that the relevant authorities are going to respond, and we hope that they are taking the tap to ensure that there is water everywhere all the time. We are back here, we are live, and of course, our discussion this morning has been around, the deployment of ICT or technology in the fight against coronavirus. We have seen it work elsewhere. Just yesterday, our neighbors, Rwanda, which is a very small country by our standards here, they started the deployment of robots to, number one, do deliveries in hospitals and avoid, the doctor or nurse to patient contact. And they're doing that actually very well. They are doing this together with the help of United Nations Development Program. And they have also, embraced the use of thermal cameras so that if it is, for example, a bus bay whereby you have multiple people, they have cameras which can detect a person whose temperature levels are elevated above 37 degrees Celsius. And those are some of the issues that they are doing. The question is, Kenya, which prides itself as the Silicon Savannah of Africa, what are we doing? We know for sure that the government has been very keen on deploying a contact tracing technology. And according to the Ministry of ICT, this is working very, very efficiently. But there is more to that. And in this morning, we have been discussing this with Delano Kilu, who is the Secretary General of PROSEC, and Peter Ngari, the CEO of, the Technical Director at Secure Digital. And I told you my Twitter handle is at OBrien Kimani, and at KBC Channel 1 is our Twitter handle. Delano, you have a Twitter handle. That's what you are telling me, right?
Yes, I have a Twitter handle. It's at Delano Kilu. One word, at Delano Kilu.
Delano Kilu.
Yes,
it's not Kilu.
It's not Kilu, it's Kilu. Kilu. You have to sing it out, O'Brien.
You have to say it Kilu.
Yes.
Oh, beautiful. It's coming out quite well. And Peter and Gary, go ahead and shoot it.
We have at SDL Kenya.
At SDL Kenya.
At SDL Kenya. feel free.
You have those 4 Twitter handles just in case you want to get through each or any one of us here on the issues that we are discussing here. Delano, you are putting some things into perspectives in the face of coronavirus and the deployment of, for example, temperature detecting cameras and their widespread use here in Kenya. And you were saying something before we went to listen to water services providers.
Yes.
What were you saying?
Certainly, O'Brien. We were talking about how CS Musheru has actually commissioned an ICT committee on COVID, and they're asking Kenyans to submit their innovation so that they can come together and harness and put together a national strategy around the use of ICT in this relevant fight against COVID. So they are trying to do something. As Ngari has said, there are some places in government where we do have thermal screening taking place. And more importantly, I think just to add to what Ngari was saying, there is facial recognition in the back end of some of the software that's running on these machines. So whether it's a bullet cam, whether your PTZ, depending on what it is, whether it's screening through your metal detector, it's possible for you to have all these deployed. Now, Kenya has done a great job. It has gone, O'Brien, extensively far above and beyond all the other countries in the region in terms of helping to monitor its population for safety and security. In most cases, the general public doesn't even know that they're being monitored. So like in the earlier example when you had mentioned, in these areas of high traffic, how come we don't have some of these things deployed? We do already have some of these things deployed. However, due to the fact that COVID is a pandemic that is bringing on board greater risk, we do need to accelerate our process. We do need to see much more adoption of this technology. And more importantly, I think you mentioned Rwanda. Rwanda has deployed 5 robots. I always ask in relevant big picture ICT discussions like this one, where it comes to safety and security of the general public, 5 robots against what population? What's the ratio of robot to population? And essentially, where are those being provided to? And lastly, of course, what's the risk to the robot technician who has to do the servicing and maintenance of those particular ones? I'm not trying to disparage Rwanda in any way, but you have to be able to actually map the need or the demand or the challenge against the provision of the resources. So Kenya's approach is a bit different, not that different, it's a bit different because Kenya looks at the big picture, and I've seen previously and even currently that our approach towards technology deployment against things like COVID, as you mentioned earlier, is things like contact tracing, where contact tracing was done very, very well right at the beginning. And even right now, we're able to identify how many cases came out of Kibra. The thing about thermal screening is it's exactly that. It is screening. It's not a confirmation. This just shows you where somebody's temperature is in a range above the normal, and it could be a case of COVID. It doesn't say that this person has COVID. We have quite a number of asymptomatic cases that are not demonstrating temperature disparities, that are walking around and spreading this. So it's a combination of all these technologies and keeping safe distance, washing hands. I like the fact that the water teams are coming on board to say, hey, we must have continual water, piped water. We need to wash our hands. We need to do things like this. So it's a healthcare crisis of biblical proportions. Let me put it that way. We're faced with a healthcare crisis of biblical proportions. And therefore, we have to come up with commensurate resources to stop this apocalypse.
I mean, oh, Lord, you're using some big words in there, biblical proportion and apocalypse. But Kilu, tell me this. I mean, what you're trying to pass across, can pass. The fact that you don't see it doesn't mean that it does not exist, right? That's what you're trying to say. But let me ask you this. But before I ask you that, I mean, let me first of all get to hear from Gary. Gary, tell me this. I mean, we saw yesterday Rwanda deploying robots in some of its hospitals. Well, do you see a situation whereby gradually, but at the end of the day, we are likely to get to that point in a bit to deal with the coronavirus?
Thank you so much. I'll concur with my friend here and my counterpart, Mr. Delano. And I will say that our government has taken measures. Before they deploy something, they do what we call due diligence. and they're able to get the information and the facts and the essence of what it can be able to help them. Number two, the essence of the country deploying robots. I can't explain or why they came up to that conclusion. But for us, the aspect of this technology behind what it has been embraced, it's able to give you what we have already set in place. We have what we call social distancing. It is able to be effected. Number two, we're able to have multiple screening. If, for example, the camera we have, which is cost effective, it is able to pick like a 30 people at the same time. So you're able to have the screening done, and it's done in seconds. If people are lining up having a 1 meter distance, it's able to capture in seconds as you pass, as you pass, as you pass. Number two, if anybody has a certain temperature which is beyond maybe 37.5, able to be isolated and be able to be inquired and asked who did you get contact to, and then you may find the abnormal fever was because of he had a stomach problem or some other disease. It's not even COVID-19. But because we were able to capture that essence of temperature hiking, we were able to see that this person is able to give more information, and you're able to scrutinally get the results and to know where did he get where did he go, and you're able to see who did he get contact with, and you're able to get that data which the government has been using very well, as Delano has put it very clearly. So for us, and each and every person, we can say the way you build your homestead is not the same way the other person builds his homestead. So we can say we are having different approach in regard to this, and that's why we have different results in each and every country that we are having this pandemic.
Delano, I mean, you know, your analogy is that the fact that you know, we are not seeing robots, it doesn't mean that they may not be there or they are there, and the fact that we are not seeing, you know, widespread use of, for example, you know, ICT, I mean, the use of, you know, for example, temperature gauging cameras, doesn't mean that they are not there. And let me ask you this, do we know of a place, of a public place, where this form of technology has been deployed? Delano.
O'Brien, it's all about the data. It's all about the data. We do know that in Kenya, we do have this deployed. We have these thermal screening cameras deployed at JKIA. That's part of the screening when you arrive. When you land, you're walking in a column, single file column, and you're walking towards a camera, and that camera is showing whether your temperature is high or not. They're not using thermoguns. There's actually a camera there that's picking and showing on a screen to port control, port health control, that you're okay or you may not be okay and you need to be put aside. Apart from that, O'Brien, I said it's all about the data. Kenya is very, very advanced. And in fact, some of these solutions that you see being deployed by teams like Ngari, which we really encourage our distributors and retailers to propagate all over the place, Kenya is actually talking about artificial intelligence. We're talking about deep learning. We're talking about these endpoints are gathering these resources into centralized pots of data, and then artificial intelligence is able to map out and tell us where we're going wrong, where we're going right. And with deep learning, it means that we're continuing to learn at every single stage of the way. And that's the difference with Kenya. And that's the difference with this technology. The more of these endpoints that we deploy, the safer our population becomes, because we have to safeguard our community, not only for our generation, but even for the generation of the yet unborn. So we do see that this deployment of technology needs to be very widespread. We've now seen that restaurants have opened up and people are beginning to stream back into town. We see traffic on the roads. I like the technology that is being deployed by Ngari and his team because it provisions us with things like facial recognition. Even with the masks, it's able to pick your eye features and map that to a database, a secure database. So these are things that means it can be able to identify you the next time you come around. You don't need to remove all the identification documents, etc. It's a hands-free atmosphere and environment that is being created in this country. The challenge, I think, for government is going to be twofold. One, the coordination and jumping or ripping across the bureaucracy and policy that slows down deployment of important technology. And two, the resources, the finances to be able to deploy this in every single county in this country, in all 47 counties, or in the areas of very, very high traffic, or in the areas where we have very high populations that are densely populated, like the informal settlements across this country. So we need to be able to start deploying it. For example, yesterday we had a prevalence of cases suddenly shooting up in Kibra. We should be able to deploy this technology today in Kibra and be able to say, okay, now we're monitoring Kibra because now we have more than 10 cases in Kibra. What's going on?
And actually, Kibra has, it has the potential to become a hotspot, within an overnight. And I mean, I like the fact that you're putting it that, cost factor may be a hindrance, in the deployment of this technology. And so, is there a way that this kind of technology can be deployed, with minimal cost?
Yes, O'Brien. Actually, I'll give you a great example. There's a certain supermarket, I won't mention the name of the supermarket.
Please
but
don't, yeah.
If you go to that supermarket, the minute you get to that supermarket, you've got a frontline healthcare worker, which is, again, forms our membership in terms of a private security guard, that is screening your temperature, and then he offers you a set of gloves. What do you immediately feel when somebody screens your temperature, offers you a set of gloves and gives you sanitizer? You feel a bit more safe. That means what has happened? Automatically, they have driven more business into their supermarket, and they've been able to use their margins to cover the cost of that. So the more safe Kenyans feel, the more business they will give you. It means a changing of our business model. It doesn't mean that all the money has to come from government. In actual fact, if you look at the history of how countries have developed, most countries developed because of strong private sector. They took people like Ngari, and they lifted them up and they gave them a platform, and those people drove those economies. So if you look at, for example, the men who built America, these are the typical cases. America was not built by government. America was built by private sector. So what we are encouraging is, rather than looking at the cost or the price, the cost is not the cost in terms of money. The cost is the cost in terms of lives lost.
Lives lost. Gary, tell me this. I mean, for example, if a system like this, if it was to be deployed, in let's say like, the Kenya ferry services, whereby you have huge traffic of people, can this technology be deployed there? And if yes, at what cost?
I'll concur with Mr. Delano here, and I say that the cost, it depends with the requirement that you require, because there are those different aspects of the product. And if you are talking about, like, you want to do deep learning, artificial intelligence, facial capture, all that, the cost is totally different. If you want to do the temperature screening only, to be able just to get to the essence of knowing this person is not beyond a certain temperature, the cost is different. And there's significant difference in terms of the cost margin. So we always analyze the client's requirement. We always analyze the need. I will give an example. A solution in the airport, JKIA, and the solution in the hotel, it is not the same. So if it's a hotel, they want to screen people as they come in and know if their temperatures is beyond, you find the cost is minimal. If it's a cost of you're doing large scale and you want to get data, facial capture, visual recognition, deep learning aspect, be able to capture that person and be able to get the date, the age, if it's a male or a female, if it's what is the temperature of a person, what is the height of a person, and it will give you all that data. We go to the artificial intelligence that is deep learning solution, whereby the cost also is different. So we can be able to gauge and say from this price to this price is what we can give. But it all depends with the specification for each and every system, and we analyze. And that's why most of the time when we are called, we say, give us the details of your premise. Give us the details of what you want to achieve. And then we can advise which solution, and we give you the cost as per your need.
I mean, these devices, I mean, technology does not operate in isolation. It has to be, there must be some forms of, controls and calibration. How secure are my records? I pass through JKIA, I pass through a hospital or supermarket, and my temperature levels, are taken. Through the use of AI, they can use my iris, to just get to know this is O'Brien, passing through here. And that is a lot of information. That is what we call the big data. How sure am I that, number one, this data is safely kept, and number two, it is going to be used for the intended purpose, Peter?
Number one, I would say that this information, it is not for public. It is not shown to the public. Like when you are captured, the information is aired, or it's able to be, you are able to see that the person walking next to has like 37.2 and you have 36.5. This data is captured in a private and the people who are screening. Like the way you walk in an airport, you get your passport and you're able to be screened, and that information stays there. So the monitoring is done by the people who have deployed this information. And if that information is secured in the essence of the company, for example, JKIA, they have that right to be able to store that information in a safe and secure way that is able not to spread and be able to make you feel threatened, or to feel that this information will be used against you. No, the way it has been done, it is able to capture the information in a way that information you can't use it to be able to alter and change and to use it in a negative way. So this is something that we call it arithmetic logarithm that is able to give you the results in terms of a different way that you can be able to alter. Yes.
Arithmetic algorithm.
Yes.
Big words here. But of course, the whole point is trying to demystify the fact that technology can and has been used elsewhere, to number one, to fight crime, and it has also been used, to help in the health sector. We saw this in China. We have also seen New York State, where the governor, Andrew Cuomo, has partnered with several companies from Google to Amazon, to do home deliveries and also to track and do contact tracing. And the same can also be deployed here, and that's the discussion that we are having here, to try and find IT solutions, to health challenges that we are facing as a country. Dilano, these systems that we are talking about here, from contact tracing systems to temperature detecting cameras, are they prone to attacks from fraudsters and cyber criminals?
Well, O'Brien, first of all, it's very difficult with new technology, because new technology comes inbuilt with quite a number of checks and balances. So hackers find it more difficult to access these things, unless, of course, the manufacturer from source has already hardwired those kind of flaws into the technology. And these are some of the concerns that were more recently raised by the US and the UK in terms of the deployment of some of their 5G networks that they are planning for the future. But that aside, I think we have a large population, O'Brien. More than 60% of us hate change. We just hate change. We don't want change. No, I want the same thing always that has always been there. And so this pandemic is causing massive mental anguish to a lot of people. And one of the things I want to assure you, regardless of what Gary has said in terms of, you know, the security and how secure your data is and how secure your environment is, I think, OBrien, you didn't even need to ask that question. And I'll explain why. Because why are you so concerned about the fact that you're going to a hospital and that hospital is automatically capturing your temperature, screening you, your facial recognition, artificial intelligence, etc., yet you, Kenyan, have gone deliberately onto your mobile device, you have already given away all this information to so many foreign information corporations such as Google, Snapchat, Twitter, Facebook, Instagram, TikTok, etc. You have given every angle of your anatomy to these such institutions. They have your personal, sensitive personal information. But they have your details, your address. Delano, there's no guarantee.
I get you, but that doesn't stop me actually also getting to understand. I mean, yes, you're getting my health information, which is very, very critical and which is not open to public scrutiny. I mean, there is absolutely no wrong in doing this in heaven and here on earth. Absolutely. I want to disagree with you on that point.
I think you can disagree with me on that point, but recently, if you look at history, Facebook was actually hacked. We have all these big institutions that were hacked, and information is out there. We've actually studied it from a security perspective. We have millions of Kenyans who have exposed their very sensitive information out online globally, and they're tagged. It's only that they're of no value to the hackers out there. If they were of value, they could perhaps then be compromised. So I'm just trying to bring the context in. Right now, the world is changing as we know it. It's becoming very dystopian, so to speak, because of this pandemic. And therefore, we have to either hide in our caves or else jump out and embrace the future. And in embracing the future, understand that the world has changed. It's not going to go back to how it was before. As much as we would like it to go back to the way it is before, we can see so many initiatives like even education trying to go back to normal education. But you can see even around the world where education has tried to go back, it didn't go back as usual. It's not business as usual. You see the students in Korea are now sitting with plastic things on their desks. You mentioned the governor of New York, Andrew Cuomo. He seems to have it all together, but he's got huge gaps in terms of how he's going to be able to reopen his city. It's going to be a big challenge. And the fact is, look, after all this discussion, we're beginning to realize that somewhere like Kenya is much, 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 much cleaner from a viral load perspective than New York. It's a surprising. You know, we're getting shocking data nowadays, OBrien. So what I'm saying simply is, yes, there was always that concern about, you know, am I a public citizen? How much does the government know? I would rather trust my Kenyan government with my information than 24 different international IT corporations that are doing it purely for profit. Then again, there was the incident that we saw in China the other day where a senior scientist was on a bus heading out to his normal activities, and he saw a call coming in from the CDC. The CDC were trying to reach him on emergency mode, and he was not taking his call because he was already on a chat on his phone. And so what these guys did is they analyzed the bus that he was in. They were able to identify that he's on the bus and he's not taking the call. They were able to identify the person sitting next to him on the bus and call that person on their phone and say, kindly, could you hand over your phone to this person because we're looking for him. So we're not yet at the China level. I don't think we're going there.
But
what we're saying is, let's trust our Kenyan government. Let's trust our Kenyan leaders. Let's trust our Kenyan private businessmen that we can do things properly, that we're not out there trying to strip away your identity and give it to somebody else or trying to steal what resources you have. We really are not yet at that place where we're a country where, you know, identity theft has become so much of a terrible crisis. Yes, we see it in the banking sector. Yes, we see it from time to time, but it's not as prevalent as in developed countries.
You know, I do agree with you there. I mean, there comes a time when, you know, things must be different and even the game has to be played differently. But Gary, I mean, help me on this. If we were to deploy all this kind of technology, how do we ensure, number one, that you know, the information that is being captured by these systems are accurate and they can be retrieved and still be relevant and accurate even 10 years down the line?
Okay, number one, I'll concur with my friend Delano and say nobody is here to put the information and pick that information and misuse in a very bad way. Number one, we need to understand that these products, when they were being manufactured, there were those that all the measures were taken in place. And this equipment, they don't work the way we think. The information that is gathered and stored in a cloud, in the recorders, in the devices that we have set in place, like the servers, they have the users who have the admin rights. They have the rights, who have been given the credentials. And you find maybe the directors or the CEO or the IT managers, only two people have the credential to access. The users who are monitoring, the users who are monitoring and capturing that data, they don't have the access because they have what we call user login abilities. User login abilities. Because when we are doing the programming, we're able to give the initial lights to only the user who is able to view and be able to capture the information. But where it is stored, you can't access without the administration right. And the person who has the administration right has the essence of, if he retrieves or downloads any information and you go back to the back end, you can tell this is the person who jeopardized this information, and he downloaded this information on a certain date, and this is what he downloaded. So unless the administrator is the one who has now he has been able to be take in captive and give the information. The other people, even if they are 100, they only have user rights. And we do that to be able to ensure the people who are doing the monitoring, they are not coerced or they are not misused. So to answer your question, our devices, our equipment, which have been manufactured by the set manufactured we have set in place, we have in Israel, we have in US, we have in South Africa, and we have in China. Yeah. They are well manufactured, and they have all those information set in place. So to make sure that the data is secure and is safe for any manipulation.
Gentlemen, hold your breath there. You know, I'll be coming back to you, but because we want to cross over and go to the Republic of Burundi. Yesterday, they were having their general elections. And if I can take you through some facts about Burundi, it is a country of about 11 million people. 75% of the population live below the poverty line, which means that they spend or they earn less than 250 shillings on a daily basis. The economy of Burundi grew by 3.3% in the year 2019. It was expected that it will grow by 4.5% this year, but because of the pandemic, this growth has been put or has been thrown into jeopardy. But let's first of all see how yesterday they went into the election. They were having their elections. And the question that has been thrown around is, how have they managed to do this during the coronavirus pandemic? Joining us from Kigali, not Kigali, but Bujumbura, which is the capital city of Burundi, is His Excellency Ambassador Ken Vitizia. He's the ambassador. He's the Kenyan ambassador to Burundi. He's now joining us from the city of Bujumbura. Good morning, sir, and thank you so very much indeed for joining us. First of all, help us understand this. How did the Republic of Burundi managed to hold a general election to elect their president and councillors, you know, at a time when the issues of social distancing are very, very critical?
Good morning, Kimani. I hope all is well in Kenya. In Burundi, we've just had an election yesterday, and thousands of Burundians came out to vote for the president, members of parliament, and the communal leaders. Your question is quite right. How did Burundi manage to hold an election amid the COVID concerns all over the world? Well, the campaigns have been massive. All the 7 candidates have had massive crowds at their venues. Burundi in itself did put a partial lockdown, in the sense that bars and restaurants were not allowed to operate in the evenings. But generally, they have had very few cases and only 1 death so far. And so Burundi has looked at the opportunity cost of postponing these historic elections and holding an election that will see the growth of democracy in Burundi, that will see President Nkurunziza hand over power to a new president, that generally signifies that Burundi has come of age democratically.
I mean, from your observation, because you're part of the Commonwealth observation team, did you see any gaps, or the process was seamless, to the end?
One, let me just correct you. Burundi is not a member of the Commonwealth. Many observers were unable to travel to Burundi because of the COVID conditions that Burundi put in place. One was that for an observer to come, you must have arrived in Burundi 14 days before the electoral period, because they insisted that you must be quarantined. So we have had very few observers. We, as the EAC ambassadors and the ambassadors accredited to Burundi, are the ones who have gone around and did the observation. And it is quite unfortunate that these elections that the world should have been here to see. Very peaceful campaigns, massive turnout, no disruption at polling stations. The counting is still going on in some areas. But we are expecting that within the end of today, there will be an indication as to who will be the winner among the 7 candidates. But here in Burundi, they don't vote for candidates. They vote for political parties.
Yeah.
So the political party that has massive following will be the one that will carry the day. But indications are that this is a tight race between Agathon Rwasa's party, CNL, and the ruling party, which has a massive following in the rural areas, CNDD-FDD.
Well, I mean, I must appreciate the fact that, that was very good of you, for correcting, my misposition. I don't know, but here we are. Tell me this. We expect, to see partial results, starting to come in, from Friday. Is there an indication, or when you scan the mood on the ground, what are people saying in terms of how the process went? Are they satisfied with the measures that had been put in place to, first of all, ensure that the election is credible, and number 2, to ensure their health?
One thing I can tell you is that the mere fact that we had so many people who turned up to vote is an indication that they believed in the process. Secondly, many of them are much aware of the various strongholds of their political parties. Bujumbura, which is the capital city, like most cities, are mainly opposition areas. So you find that perhaps Rwasa will carry the day in Bujumbura, and 1 or 2 other provinces. But generally, like in most elections, people are always afraid of the post-election violence, not really the electoral process itself. Because the electoral process has been seamless. Voting was quite peaceful. So we are hopeful that, and we are encouraging Burundians to accept that there will be a winner. Some parties will win in certain areas and not win in others. But the general climate is that the overall winner should be the one who will garner more votes across the country and not just.
Generally speaking, when you look at Burundi, I mean, they've been having so many challenges, from civil wars to, a serious political instability, to poverty levels which are pretty much elevated. In this case, what were people voting for, when it comes to some of the challenges, that Burundi is facing as a country?
One thing is that why I say these are historic elections is since the independence of Burundi, every election has been very violent. And every elected leader in Burundi has always been killed after the election. This is the first time actually there will be a peaceful transfer of power from one incumbent to the next. And perhaps the international community and the region should actually be commending how things have turned out, that President Nkurunziza, despite the fact that he could run again, the new constitution actually allows him to run again. He opted not to run again. This is quite commendable. Mm-hmm. And then we have now 7 candidates, including 2 opposition figures who left exile and came back, and they are taking part in this election. Rwasa has been a perennial competitor against Nkurunziza. General Evariste is a new candidate. He has had only 2 months to campaign, but the power of the political parties, CNDD-FDD, might help him carry the day. But Rwasa's showing in this election will show that there is a formidable opposition, perhaps in the Legislative Assembly, to the CNDD-FDD. And so Burundians are looking at, 1, an end to corruption, which they claim has characterized Burundi since independence. They are looking at increased economic activity and development in Burundi, and they believe that this is a new beginning for the international community to engage with Burundi. Engage with Burundi so that Burundi can see peace and stability, to enable investment, to enable development assistance. This is what Burundians are looking at in this election.
Tell me things. I mean, there has been a lot of criticism, on the way that, the government in Burundi, has conducted these elections, and especially coming from the West. Of course, they must be having their own interest. And one of the issues that has been picked up, especially by the European Union, is the fact that the government has locked out observers and giving them, some tough requirements, according to them, that any observer who is coming into the country must, first of all, go into a 14-day quarantine. And this has been picked as one of the red flags by the West to say that this election is likely to be opaque. Do you agree with them? If you do not, you're doing so on what grounds?
One thing I can assure you is that one of the things that Burundi has managed to do that many other African countries should learn from is that they have held these elections without external assistance. The European Union, the UN, or anybody else has not given Burundi any money to hold these elections. And because Burundi believes that this money comes with the conditionality. So Burundi has held these elections with its own resources. Secondly, these are elections by the Burundis for the Burundi people themselves. So the biggest stakeholders in this election mainly are the Burundi people themselves. And the government insists that it's the Burundi people who should be the main observers of their own elections. 2 months ago, the government gave out guidelines as to what the observers needed to do in order to observe Burundi elections. People had sufficient time in order to send observers, as long as they met the 14-day quarantine period that Burundi said they were not going to change that just because of the election. That people needed to come early enough, take the 14-day quarantine, and then be able to observe the elections. But we believe that what we are seeing here as regional ambassadors, as African ambassadors, and even the European Union ambassadors who are here, if they were sincere enough, they will know that these elections have been quite peaceful. This elections has seen a massive turnout, and we believe that this should herald a new beginning in the engagement between the international community and whatever new government that might come in Burundi.
You know, when you look at you know, the electioneering period, I mean, the opposition, which is led by retired Army General Everest Dayishimiye, they were saying that there was a lot of voter intimidation, which was meant to scare away opposition supporters. Was it? Did you see anything like this when you are traversing the country? And was it evident yesterday? Did we have massive turnouts even in opposition held areas?
The main opposition person is Agathon Rwasa. General Everest is the candidate of the ruling CNDD-FDD party. So as we went around, the campaigns were very peaceful. Agathon's strongholds are mainly the main city, Bujumbura, and Bujumbura Rural, which is an adjacent province. And as we went around, the massive crowds that came out, it would have been very difficult to intimidate them. People came out in large numbers. This is the first election I'm looking at 80% turnout. And you'll be seeing the pictures. The pictures there were huge crowds. Until 4 o'clock, people were still on the line trying to vote. And we encouraged the Burundians as we went around that you are having your say through the ballot box. You are having your say. But at the end of the day, after the results have been counted, the majority will have their way, but the minority have had their say in this election. And we are very hopeful that after this election, all the Burundi stakeholders will come together and say Burundi is more important than all of us. As they sit in parliament, they will be able to say what type of Burundi do we want to have moving forward.
Have you managed to engage with the opposition leader, Agathon Rwasa? And what is the opposition saying in regard to yesterday's election, and what is the ruling party saying in regard to the same?
Prior to even the elections, we have continued to maintain an engagement with both the ruling party candidate and with the main opposition figure, Agathon Rwasa. We have continued to encourage them so that even after the elections, the two of them can continue talking. The former vice president also, who is also Mr. Sindimo, is also, yesterday he gave out a very good statement. He said these elections have been very peaceful, and we are hopeful that from when the results are announced, Burundians will be able to accept that some people made their choices. Those who carry the day, we congratulate them, and we let Burundi move forward.
And in the interest of time, because I have to let you go, Bwana Balozi, what lessons do you think the rest of the world or the rest of Africa can learn from, number one, how Burundi conducted the elections yesterday, and number two, how the process has been since day one?
One of the lessons many African countries can learn from Burundi, one, these are very peaceful elections. Many ambassadors who went round were pleasantly surprised that people were very disciplined, stayed in the queues for long. There were no disruptions in any polling station. There was no money being given to people to vote. Secondly, this was simple but efficient elections. In many African countries, elections cost too much. Perhaps people need to learn a leaf from Burundi. Burundi has held these elections without spending too much money. They have had many volunteers. They have used, they were able to cut down on the expenses by using what they've had in the past, what was donated before. So perhaps we need to learn a lesson from this. And thirdly, perhaps as one of my closing remarks, From 2015, the whole world was condemned Burundi, that President Nkurunziza wants to stay in power forever, and that he was changing the constitution so that he can rule until 2034. But surprisingly, when President Nkurunziza said that he wasn't running again, despite the fact that the constitution now allows him, the whole world became mute. Nobody appreciated that fact. He was not commended for what he has done. This should be an example that those who opt not to run again, they need to be commended, so that to encourage others to do so. Like we have several examples in the region who need to be encouraged to hand over power. And Burundi should be an example to the rest of Africa that you can hand over power and become a civilian and go to your farm and continue helping the country in another capacity.
Thank you so very much indeed for joining us. And of course, you know, as the time goes by and as we wait to hear who actually will carry the day, we'll keep on engaging with you, Bwana Balozi. Asante sana.
Thank you.
Stay safe.
Thank you very much, Kimani. We will keep you posted and keep safe there in Kenya. Absolutely. We are keeping safe in Burundi.
Thank you so much. Very well.
Thank you.
Ken Vitizia is the ambassador, is the Kenyan ambassador to Burundi, joining us there from Bujumbura to give us an update on how the Eastern African country of Burundi has managed to carry out their elections. Remember, they went to the polls yesterday, and the process of tallying the numbers is currently ongoing. Burundi so far has 42 confirmed cases of coronavirus and 1 reported death. These numbers have been criticized, because the testing capacity of Burundi, you know, is pretty much low, but we'll be looking to see how they're going to move forward from here. This is Bizcheck. We are live from Broadcasting House. We are taking a short break, and thereafter we'll be back. Remember, we are discussing the role of IT in the fight against coronavirus. We are back shortly. Stay right here.
Je, ungependa kujua jinsi ninavyojizuia kuambukizwa au kuambukizana virusi vya korona? Ni rahisi. Mwanzo, ninaziendesha shughuli zangu zote za kikazi na hata za kibiashara kutoka papa hapa nyumbani kwangu. Baadaye, ninaitunza mwili wangu vyema kwa kuiweka katika hali iliyo sawa kupitia mazoezi ya mara kwa mara na pia lishe bora. Mwishowe, ninaungana na jamii yangu pamoja na marafiki zangu kupitia njia ya simu au mtandao ili kuzuia dhiki na upweke wakati huu mgumu. Kumbuka, haijalishi kama uko na virusi vya korona au la, salia nyumbani, uokoe maisha.
This message has been brought to you by the government of Kenya and its partners.
Hapo basi nyinyi ndio mwanamke unavyokosea. Young man, you are way out of line.
Are you on her side ama are you with us?
Sikuelewa teacher akifunza mambo ya photosynthesis na pollination.
Hiyo ni ziara ya manini?
Hakuna. Nilikuwa nimenunua shopping kaja nayo jana hapa.
Sahi wasana unua vitu sigile. Kuna hasara hapo.
Hata uweza kuizi na matajiri hata kidogo.
Uncle Job alisema atafunga nyumba.
Mudhe, tafadhali tu nipatie tu dakika moja. Mimi Job unakula chakula ya watoto seriously.
Tiffany must not leave the country.
Aisha pango.
think we should leave.
This weekend on KBC Channel 1.
I did not ask you, Atito, to introduce me to people. I know how these things work, okay? Huh? Feel free to pretend that you don't know me while we are there. And let me do what makes me happy, so should you.
Atito, you know it is outrageously funny how you are getting mad of an activity that you did not even sponsor, even with one coin. What is wrong with you today?
Correction, not lasting, but appreciating the view I present. Can you blame them?
So what do we call this kind of madness? To make it worse, those old pieces of clothes. What were you two thinking? Hey.
Classmates, every Saturday on KBC.
Welcome back. You're watching Bizcheck. We are live and we are on air at OBrien Kimani. It's my Twitter handle at KBC Channel 1. Is our Twitter handle. This morning we've been discussing the role of ICT in helping fight the coronavirus pandemic. We have seen unprecedented widespread use of ICT in the fight against coronavirus. It started in China, with the deployment of high-resolution cameras to identify people who are showing signs of coronavirus, to robots, to drones, to pass messages for people who are not observing the physical distancing directives. And we have also seen this, even being deployed in other countries whereby driverless vehicles, are roaming the streets of New York and urging people to stay at home, and those who are not observing social distancing, being reported to the authorities, and of course actions being taken. Here in Kenya, the government has adopted, contact tracing, which is a very complex, algorithm whereby you have to know who came into contact with patient A and what did they do, where were they, and all these. And this is definitely a lot of work. You may not see it, but it's absolutely happening. That is a message from one of our guests this morning. Delano Kilu is the Secretary General of PROSAC, and Peter Ngari, the Technical Director at Secure Digital. Gentlemen, before we went for the break, the issue on the table was about the security and the efficacy of this big data being collected, by multiple sources, from hospitals to supermarkets, to streets, to bus bays and terminals. That was a question that we were asking ourselves. And Delano, you're saying, we should not be so much concerned, about the health of this data, bearing in mind that we have given out so much. And my argument was, that should not be a justification point. And so the question is it possible, number one, to secure all these data at the same time and to ensure that this data is stored in a good place and it is also accurate 5 years down the line, Delano?
I think, O'Brien, we first of all have to look at where we are as a country. If you look at information and the way it's controlled in this country, specific to citizens, this falls under Cabinet Secretary Matiang'i and PS Kibicho. You will find that the infrastructure that has been put in place is excellent. We don't have leakage of citizens' private data in Kenya at all. And then you look at it from a security perspective, we have to single out our Inspector General, Hilary Mutyambai. He's done an excellent job in terms of being able to safeguard individuals' data, to fight things like cybercrime, to be able to put in mitigation measures where there is crime regarding identity theft. I think we have seen those numbers going down. Now we're in a pandemic. It's a bit different. Again, I really want to commend our frontline healthcare workers in the form of the National Police Service. When people have gone on curfew and lockdown, these are the guys and girls who are manning our roadblocks. These are people who are serving tirelessly in every part of the country. When you're hearing this very heavy rain, trust you me, police officers, military officers, our discipline forces, those are the guys on the front lines. And then, of course, our private security workforce, which is numbering more than 700,000, O'Brien, all of our resources in terms of private security are on the front lines of this pandemic. When you go to your supermarket to go and collect your tomatoes, they're the guys who are asking you to sanitize, they're the guys who are doing the screening, and then there's the doctors and the nurses, of course, we can't forget about them. But when you look at all this, right now there's what we call an acceleration of information. Why? Because we are now collating more information than we were collating in December 2019. That information has to be gathered, stored, and secured, and primary methods of gathering that information is what we call endpoints. These endpoints are the entrances or the real traffic gates and places where you're going to go and transit into a different area or into a different organization, facility, or site. Now, in terms of the future, O'Brien, I think this is the exciting part.
Yeah.
We're looking at the future, not just around the world, but here in Kenya. We're looking at a future where there is definitely, and with the deployment of the solutions Ngare is talking about, in terms of the thermal screening and in terms of some of the AI, artificial intelligence, and some of the deep learning, you're going to be seeing a situation in the very, very near future where we're going to be having what we call virtual fencing. And virtual fencing simply means that CBD Nairobi may reach a point where government will only allow a certain percentage of population to be in certain areas at any given time. So if it looks like it's going too high because of social and physical distancing, because of virtual fencing using technology, they'll simply be able to say, sorry, this particular area, or certain individuals are not able to access particular areas. So we're going to begin to see virtual fencing coming up in the near future, not too far from now. But again, we want to encourage, because O'Brien, let's talk about the elephant in the room regarding technology, is our youth population. Kenya is 77% youth below the age of 35. I think we can use 35 as a measure. 77% of our population is youth. They're very agile, they're very adept at technology, they want to use technology. All these people who we categorize as our youth, the new forms of business, of work, of employment, of going to the job in brackets on Zoom or wherever else is going to be heavily dependent on technology. So we need to then embrace solutions like what Ngari is talking about, where our thermal screening enables us to work in safe environments if we have to physically get together, or else we're moving back to technology. So a lot of the new millionaires and billionaires in Kenya are going to be driven by technology or by solutions to prevent the coronavirus.
You're talking about virtual, fencing, and we saw this somehow being deployed in Wuhan in the first months of the virus. Gary, do you think we as a country, we have the capacity, number one, to deploy that kind of a high-level technology whereby, a certain number of people are restricted in a certain area when you look at it?
Thank you so much. I can say it's very possible, because as we have been discussing, we are saying that this is something that we didn't expect. And when the unexpected comes to you, you're able to take the measures, no matter how much it takes, no matter how long it can take, to make sure that you're able to secure and to be able to protect and to prevent whatever danger will come along. So nothing is impossible. As long as we take the right measures, as long as we take the right precautions, nothing is impossible. So we can be able to to take your fencing in a very drastic way and be able to have it done and be able to take the information that we have and be able to prevent mass transit from one border to the other and be able to control, to be able to prevent and use the technology to enhance everything that we are doing. Yes.
When you look at Kenya, I mean, with the population, and Delano has tried to put these figures into perspective, with 77% of the Kenyan population aged below the age of 35, and with mobile penetration of more than 110% and internet penetration of more than 55%, why is it then? Why are we adept to technological change, Delano?
It's a bit of a conundrum, O'Brien. What we should be doing is we should be actually encouraging all of us. Kenya is what we call the face of mobile money globally. Because of M-Pesa and because of innovation. We should actually be the country that is coming up with global solutions based on smartphone applications, based on access to cloud, based on analytics, based on free thinking, and in terms of being able to generate secure environments, not only for ourselves, but for those around us. We have an enormous population of people who are thinking in a completely different way from how we were taught when perhaps we moved from the old it was CPE to KCSE. So we now have a different generation that's now looking at skills-defined education. And we should actually use this to put ourselves on the front foot, transform our thinking, transform our ways of education, transform our ways of innovation, create an innovation factory, create innovation funnels for this generation to be able to provide us with the security solutions for the future, to be able to provide us with the health solutions for the future. For us, from where we sit as the Protective and Safety Association of Kenya and the Private Securities Congress, we see now healthcare has become part of the safety and security panorama that we have to look at constantly and from every dimension. And we do have young people who are coming out and coming forth from the community to come and say, hey, could you take a look at our solution? Would it work across the entire population of Kenya? And how can we be of service? So what I would encourage is our frontline big corporations, the large telcos and the large banks, begin to have a more listening ear to the younger population, begin to have, O'Brien, a more open heart to hear where are homegrown solutions being found. Let's stop looking too much towards innovation from Silicon Valley or from China or from Japan. Let's start looking at new solutions because the entire world is starting from the same starting line. You cannot say that this developing country started before us or that underdeveloped country was ahead of us. We are all on the same line. So Kenya has an opportunity not only to leapfrog from where we are, but also to become a solution to the world's problems.
Gary, quickly, because I can see time is pretty much catching up with us. Stakeholders in the education sector, are saying that, we cannot shut our schools forever. At some point, our children must be allowed to go back to class and learn. Is there any way we can deploy technology to keep our students and our pupils safe while at the same time they attend classes? Because absolutely, the issue of virtual learning is not working for everyone.
Exactly. There's no way we'll be able to go back to school and we don't embrace technology. And we make sure that we use technology to be able to know that no matter what happens when children are together, they're able to be safe. For example, you have seen there before, and if you have a child, you have recognized that. When they go back to school, you find a week after or 2 weeks after, they have a flu, they have something, they have a stomach problem, because they are in an environment that they are touching things and they are cooperating together. So unless you're able to take measures and embrace technology where necessary, we're able to safeguard and avoid any danger that can come to our children. So no matter what, I can say that we need to embrace technology and use it to our schools and look for ways to be able to step a step further as we come to the essence of children going back to school. Yes.
Delano, do you concur with Ngare's sentiments?
I agree with Ngare, except now what we need to do is we need to define. You know, when we say technology in general, it doesn't actually give us the solution or the answer. For our children to go back to school, O'Brien, we need to find and innovate and utilize ways of doing mass testing using a very short amount of time, so that every single day when children have to go to school and be cloistered in one compound, we should be able to test all the children. Non-invasive testing. You see, right now the kind of testing that we're doing, the swab test, is very invasive and very painful and very scaring for a little child. And then again, it takes so long for the results to come back. But with technology, you know, we'll begin to leapfrog some of these things, and we should be able to have something that within a few seconds, you can tell whether this child is infected or affected, and separate them and isolate them, and allow then children who are not infected to be in a compound together. That's going to be the future of school. If we want to have our children physically play together and physically interact with one another and gain the learning from meeting with their teachers, then we have to be able to ascertain that the compounds that they enter into are completely COVID-free. And the only way that can be done is by testing. So we're now going to migrate, O'Brien, predictably, from an area where we're talking about sanitizers and masks and all that sort of thing. We're rapidly going to and about to migrate into a session where it is all about testing, different types of testing, and the standards of testing. Again, best practice has to be implemented to make sure that the tests are not, you know, insufficient, that we're actually getting 99.95% correct testing methods. And that's a big burden now for our Cabinet Secretary, Kagwe, and the CAS and the PS, to be able to bring together the Ministry of Health and to be able to come up with the model for testing in Kenya. They've not had much time, they've really been rolling with the punches, but Kenya has done an outstanding job, as recognized by international media, in terms of handling this crisis. And most importantly, O'Brien, remember, our children are really our heart. So there has to be a psychological process where we break that out to the parents as well as the children. Remember, the children in Kenya are very intelligent. From standard 1, standard 2, standard 3, they understand what is going on. So you need to be also able to bring them on board in terms of even the issue of going back to school, social distancing, and avoiding getting infected by this microbe.
Gary, as we wind up, what is the future of, or how more widespread do you see ICT being used to fight the coronavirus? Because from the World Health Organization's point of view, this pandemic is with us for a long time.
Thank you. As we said when we began, the crime has not stopped, but it has drastically dropped because of the embrace of technology in terms of surveillance solution. The same thing, we have the pandemic to stay with us. And the only way is to be able to take precautions. The other way is to be able to embrace ICT aspect in terms of technology. We use the equipments and the technology where necessary, and we're able to come to reality that ICT is here to solve most of the issues that we are facing. So we are able to agree and say that ICT is the future, ICT is the way to go, and we are able to move forward and get results in one way or another.
Very well. Thank you so very much indeed, gentlemen, for joining us here. But Delano, before I let you go, do you see an IT solution to face masks? I mean, we can't wait to see those things off our faces, right?
You know, O'Brien, you're asking an interesting question. We actually have a solution from Canada, and what they call it, they call it a liquid mask. So you actually spray it over into your nostrils and down your throat, and it actually protects you for about 3 hours.
3 hours.
Very, very early stage. That's very early stage. So perhaps in the next couple of years, something will be innovated where you actually get that spray in and it actually protects your entire nostril and your throat, etc. For a longer period.
You can't talk about 3 years. I mean, you can't talk about years. We don't want to stay with face masks forever. I thought you were talking about next week.
We'll be having face masks for a long time. I think people will become innovative and start being very creative with the type of face masks that they have. But face masks are here to stay for quite a long time, O'Brien, unfortunately.
We need to breathe. Anyway, thank you so very much indeed for your time and for your contribution, guys. We'll keep in touch. I mean, let's see how and where we go from here in terms of, IT and coronavirus. Don't worry if I call you back here in the future. Otherwise, you're highly appreciated. Stay safe, wash your hands, and keep more of physical distancing. You have been watching Bizcheck. We have been live from Broadcasting House. My name is OBrien Kimani. Nancy Okwara is coming up next with Tamurini. They are picking up from where we are living this morning. Remember, at 9 p.m., we'll also be discussing more about the economic impact of coronavirus and what needs to be done going into the future. And then, why don't I see you then? Let's keep engaging at OBrien Kimani. Have a good afternoon.